Okay, that's great. So let's get started, okay? So, hey, you know what? It's time for me to say good evening, everybody, and welcome to a new MS Views Now program, okay? And we started this MS Views Now at the beginning of this pandemic, and it's just a virtual series that we're doing. And for those that don't know, my name is Stuart Schlossman, and yes, I'm the president of MS Views and News. And yay, I'm also an MS patient, right? How else can I bring you all these types of things that, I literally do know what we feel and what we need and the types of programs that, we used to offer in-person programs, which we will be starting again soon. We're going to be doing our first event on June 30th. We're going to do it in Savannah, Georgia as a live in-person program. All right. And we have some great safety guidelines for everybody that's going to be there to follow, including wearing masks, including they could wear masks to come in, and then when they get seated, they, at their tables, they can, which will be assigned tables, they can take off their masks and they'll be able to eat there as well. But I want to get started with tonight's program, all right? So before I begin, though, I want to let you know that we want to thank two supporters of tonight's program. We have Genentech and we have Bristol Myers. And I'm going to give them a round of applause because we can't actually do this live, all right? But we're giving them a round of applause. Great, thank you. All right, next we have, we can all recognize that COVID-19 has added tremendous stresses to all aspects of our lives, the community as a whole, as individuals, to the family structure, employment, and family concerns, and as people living with a chronic disease. Today we are going to be discussing, well, not we, but Dr. Harris will be discussing mental health, specifically in relation to COVID-19. He's going to be looking at management of stress and anxiety, impacts on family relationships, and adapting to changes in the way we're living now. So before we begin the program, though, I want to tell you about the format. So the format of tonight's program is Dr. Harris is going to speak for approximately 10 minutes, and then we're going to do Q&A. All right, we're going to do that for about 8 minutes, maybe 5 minutes. All right, and then Dr. Harris will speak for another 10 minutes, and then we'll stop him again and we'll do another round of questions for another 5 to 8 minutes. He'll then speak again for another 10 minutes, and then we'll finish up the evening with another 5 to 8 minutes of questions. Okay, but so where do you know where to go for this and where you can type in your questions? Well, now we're going to let our video producer, Bill, speak with you about this. It's your turn, Bill.
So if you look at your screen here, there's a control panel to your right where the question box is pointed out by the red arrow. If you type your questions in there during the talk, at the time the questions come up, Stuart will go ahead and be asking those questions for you. And that's all.
Okay, great. Everybody got that? If you don't, ask a question and we'll answer the question. I can type your answers directly to you. If you just want to make a general comment about anything, or if you have a question to ask, please fill it in there based on what the doctor is asking about, I'm speaking about, or anything else that you might have for the doctor, and we will read off your question. Okay, so right now, I just want to let you know that we're all very, very excited to welcome clinical psychologist Rick Harris. And again, let's welcome Dr. Harris. Here you go. Thank you.
Thank you. Stu, thank you so very much. First of all, I just want to thank you and the staff at MS Views and News for all that you do. It's incredible, the information that you bring to your client and the people. And I just really appreciate being here tonight to talk about what we're going on. Certainly, this has been a really, really difficult time for all of us. I was reminded that last week I was talking to a friend of mine, and I said, I feel like I'm living in a sci-fi movie. And I said, the sad part of it is I feel like one of the characters in the sci-fi movie. I'm reminded I was at Publix, and Publix had their one-way aisle, and I was admiring a head of lettuce. And all of a sudden, I saw this hand come in to grab a cucumber, and my first reaction was I jumped because that person was in my space. The pandemic is so palatable, we can feel it, we can touch it when we walk outside. And we know that the fear, anxiety about any disease can be overwhelming and cause strong emotions in all of us. Stress during any kind of infectious disease outbreak can include fear, worrying about your own health, the health of your loved ones. It can change your sleeping or eating patterns. It can really affect our ability to concentrate. It can increase use of alcohol and tobacco. We definitely have seen an increase in alcoholism and drug addiction. And the thing that is so important in our topic today is we see that that stress and that anxiety can also affect our health conditions. In general, we're seeing that people are reporting significant and sustained increase in symptoms of depression, anxiety related to just the pandemic. We see the number of people reporting these symptoms are at historical portions, way above the norms. We recently, there was a study done in which we screened people, and according to that screening data, there was a 19% increase for clinical anxiety in the first week of February, and a 12% increase in the first 2 weeks of March. And nearly half, 45% of adults in the United States reported that their mental health has been greatly affected by this current pandemic and negatively impacted due to worry and stress over the virus. Now, let's just take a look at the effect on MS, because that becomes really important to what we're talking about today. Research showed that anxiety was the #2 mental health issue that MS patients experience. And the incidence or the the common rates was from 16 to 48%. If we now consider COVID-19 on anxiety on MS patients, it increases those ranges that from 35% to 67%. So 2/3 of you all listening have seen an increase of anxiety from the pandemic. But what does that mean? What is the symptoms of anxiety? How do we identify what that anxiety is? So it's the presence of excessive anxiety, or you're feeling that adrenaline rush, that fight or flight syndrome, or worry about a specific topic. The worries difficult to control. The anxiety and worry associated with physical or cognitive symptoms, edginess, restlessness, fatigue, tiring, irritability, increased muscle aches or soreness, difficulty sleeping, and that's due to trouble falling asleep or staying asleep. So we certainly have seen an increase in anxiety in the general population, and that patients who experience MS are certainly more vulnerable to anxiety. So what do we do about it? This is tip number 1. If I had one gift to give to everyone, this would be it. Richard Alpert, who was a psychologist in the late 70s, later became known as Baba Ram Dass, after he studied meditation and yoga and adopted Eastern philosophy, he wrote a book, Be Here Now. And what does that mean? What does that truly mean? If we stop to think about time, time is an abstract concept. Stuart already said to you, there's going to be an event coming up in June in Savannah, Georgia. That's an abstract concept. We invented time to coordinate events. So think about that. If time is an abstract concept, what exists in time? Does the past exist? No. Does the future exist? No. So the only thing that truly exists in time is this very moment. This moment that we're experiencing right now is the only thing that exists. And if we think about that for a moment, the next question we have to ask ourselves, what do I have control over? Do I have control over the past? No. Do I have control over the future? No. And that's the most difficult concept to understand, is we don't have any control over the future. And I believe that pandemic has certainly brought that home to a lot of us. Who would have ever thought that we'd be wearing masks to go to Publix, that we'd have to keep 6-foot distance, that we would be stay at home? Now, I'm not saying that plans and goals are not important in life, but plans and goals are our own subjective reality. It is what we would like to see happen. And it's important for us to understand that when we think about the future and we use the words what if, we cause ourselves anxiety in the moment. When we say to ourselves, I could have or I should have, we put ourselves in the past and cause ourselves to feel guilt or shame in the moment. Stu's back, and I guess it's time for questions. Whoops, Stu, I can't hear you.
Gotcha.
Okay, good.
Gotcha.
Thank you, buddy.
I have MS, I forget. So I forgot to put the sound back on.
That's all right.
So the first question is from a person who says that he or she, I don't know if it's a he or she, has a weekend trip planned close to home. The hotel that he or she is going to is following all CDC guidelines that they know about, as well as the beach being monitored. And this person is afraid, worried, and anxious, and wants to know what can help he or she overcome this.
That's interesting. That's a great segue into what I was just talking about.
Correct.
So what that person is saying to themselves, what if? What if they're not following the guidelines? What if I'm exposed? Right now, that person is putting themselves out in the future and causing themselves anxiety in the moment. What can you do about that in this moment? And it sounds like the person that asked that question has done everything they could. They've done their research. They found out that that hotel is complying with Center for Disease Control recommendations. They're patrolling the beach. So there's nothing that you can do now about what might happen if you go away for the beach. The only thing you have control over is this moment. And so now you're causing yourself anxiety about what might happen this weekend. And there's a chance that we might get a thunderstorm. You might choose not to go. And so here I am, anxious about going, and there's a chance I might not go. Moment to moment is what gives us control.
Great. So, feeding off on that, though, and before I get to the next question, you brought up a few moments ago about MS Views and News doing a program in Savannah, Georgia on June 30th. Yes, there's anxiety about this too. It's not just for the patients, it's for the organizers too. Are we filled with anxiety? No. Why? Because we're prepared. Okay, we really, really did our homework on this and what we need to do to make sure that everybody that's attending this program is going to be safe. Okay, it is safe. It's safely put together. Okay, as long as you're there, you're going to be safe from being in contact with anybody else. But I can't help if the ceiling falls down. All right, that's a different story. All right, so I can't help that. But going forward, let's go to the next question. So I just want to let everybody know that it's not just the people, though, that might be wanting to attend, wanting to get out of their homes, but even the people where you are going to also have, could have anxiety built up, and how can they get past those things too? All right, next, being in the time of all this coronavirus going on, how has this caused other mental anxieties or illnesses, I should say, mental health altogether for the general population? What can you say about that?
So what we saw in some screening data that was done by the center, the NIMH, National Institute of Mental Health, is we saw an increase of almost 50% of adults in the United States that said that their mental health had been negatively impacted due to worry and or the stress over the virus. So we've seen an increase in anxiety, an increase in depression, an increase of drug use, an increase in domestic violence. So it's definitely impacted the mental health in general.
Okay, thank you for that. Was there more you were going to say about that?
No, that's
okay. Great. So being more specific to people living with multiple sclerosis, how has this affected communities who are living with other chronic conditions as well?
So I think, first of all, let me go back and just touch on that. That's a good question. But certainly, if any one of us has a chronic condition, our mantra is, what if? What if this happens to me? What if this medication doesn't work? What if I relapse? What if my condition deteriorates? And so what we're doing right there is, again, causing ourselves anxiety over something we have no control over. So the minute anyone hears those words, what if, they need to say to themselves, stop. What can I do about that now? There's not a damn thing I can do about some of those things. But maybe there is. Maybe in the moment, I can make sure to take my medication. I can make sure to take care of myself. But I can't control the future. And so often with a chronic illness, the mantra is, what if? And that's where we get into trouble.
Okay, thank you. Another person writes, sometimes it's difficult to recognize anxiety. Can you share with us what are some signs and symptoms that could increase awareness of anxiety when it is occurring, and what we can do to help reduce these feelings?
Okay, so I want you to imagine that all of a sudden, I don't know where y'all are sitting, But I want you to imagine that wherever you're sitting, you hear this big roar and your door comes crashing in and you look up and there's a big grizzly bear there. Well, your body's going to respond. Your heart's going to race. You're going to have difficulty breathing. Your breathing become more shallow. You might get lightheaded. You might start to sweat. You might have a feeling of unreality. What's happening to your body is it's getting ready to fight or flight. And if your judgment is good, you get your butt out of that room real quick. So all of those body symptoms that are happening are getting us ready to fight or flight. They have meaning. When we start to feel those same symptoms, okay, whether it's a little heart race, little edginess, our concentration is a little impaired, a little irritability, muscle tension, and it's elevated, that is what we call anxiety. And it becomes a disorder when it starts to affect us in our personal life.
Okay, thank
So
you for
those are
that.
the symptoms of it, yeah.
Thank you for that. Feelings of fear and being isolated has been challenging. What can I do to stop obsessing about catching the virus?
Going back. So first of all, there's about a couple of years ago, I had a young 16-year-old adolescent in treatment with me. And she said to me, so you're teaching me the Rick method. And I looked at her and go, what are you talking about? She said, the R stands for recognize. Okay? So in this case, is to recognize I'm obsessing. The I stands for insight. In this case, the insight is I'm causing myself anxiety. And the C is about confronting the obsessions and recognizing that it's irrational thinking and saying to yourself, right now I'm okay, and that's all I know. So it's recognize, insight, and confront the Rick method that helps change those thinkings and behavior. But you also bring up another point, Stu, is certainly when the grizzly bear enters the room, we have a fear response. Anxiety is perceived fear. It's not actual fear. It's perceived threat to us. The grizzly bear is an actual threat. It's perceived threat.
I'm going to let you go back into your regular dialogue now, and then we'll go back to questions in a few minutes, okay?
Okay. So let me just review, because I think this is, again, so important. Anxiety comes from perceived threat, not actual threat, and comes from our thinking, so what if thinking. So if we can recognize that what if puts us out in the future, causes us anxiety because we don't have any control of the future, then the task for us is to recognize and that what if thinking and bring us back and say, the only thing I have control over is this moment. Moment to moment gives me control of my life. And like I said, this has implications not only in dealing with a pandemic, but also with your MS. Look at what you have control over in this moment. So the second the most experienced issue, mental health issue that MS patients report is depression. And the depression rates without corona runs about 25 to 54% of most MS patients. If we look at that post-corona, we have to recognize that the incidence can be from 43 to 72%. Remember I said in general public, almost 50% of the people who report it are saying that it's affecting their mental health issues. When we take a look at MS patients, we know that 50% of them are going to have one significant period of depression throughout their course of the illness. And that's higher than the general population, and that's higher than any other chronic illness or any other neurological disorder. And the problem with depression, it is often unrecognized or misdiagnosed among MS patients. Certainly, when we start to look at what's happened with the pandemic, with our stay-at-home orders, it has caused us to be more socially isolated, more withdrawn. Things that we used to find that were socially reinforcing have been removed from our lives. And so we're isolated, withdrawn, nothing reinforcing in our lives. And those are some of what can cause the depression. So let's take a look at what is that? What do I mean by depression? I'm not talking about sadness. Sadness, we all have sadness in our life. The symptoms of depression are depressed mood, okay? That doesn't change throughout the day, although is a type of depression in which, it's like the clown. I'm laughing on the outside and crying on the inside. I can be responsive and nobody would know it, but inside, I'm just chronically always depressed. Depression affects our interest. We have a loss of interest. It affects our appetite. We may find that we gain weight or we lose weight. So it can cause us to crave foods or lose our appetite. We may have difficulty sleeping, falling asleep, staying asleep. We may also have what we call early morning awakening, where we get up before we want to. Feelings of agitation, irritability, can't sit still. Or I'm so leadened that I feels like it would take a superhuman effort to move a muscle. Fatigue. And this is interesting because it's common among MS patients to also experience fatigue that's separate from the symptoms of depression. Feelings of worthlessness or guilt, feelings of hopelessness, diminished ability to think, my concentration is affected. And certainly some recurrent thoughts of death or suicide are common symptoms of depression. So it is the number one mental health issue that MS patients deal with, and certainly exacerbated by Corona and the pandemic. And so often I'm asked, what causes this depression? Certainly, it's expected that when you're first diagnosed with MS, that you're going to go through a period of mourning. Elizabeth Kubler-Ross identified the stages of mourning. And the last stage is acceptance, accepting that you do have the disorder. That's not what I'm talking about. I'm talking about chronic depression that lasts over a period of time. So what are the causes? And if you can imagine 3 circles, a Venn diagram, and whenever I'm looking at the causes of depression, I look at 3 major factors: the biological factors, psychological factors, and environmental factors. When I talk about the biological factors, there are 21 symptoms associated with depression. Aaron Beck identified these symptoms and developed an assessment tool called the Beck Depression Inventory. Out of those 21 symptoms, 13 of them I've identified as having a biological component. What do I mean by a biological component? That there is a dysregulation of brain functioning, that there might be a commonly referred to as a chemical imbalance in the brain, and may require medication in which the body or the brain is not producing enough neurotransmitter, or that the receptor sites on an opposing neuron are not receiving the chemical. They may require medication, antidepressant medication. The second factor is the psychological factors that can contribute to depression. Certainly the profound losses of maybe the death of a spouse, the loss of my physical abilities, the loss of a job, trauma I might have experienced can affect depression. And as I said, the big factor that we're talking about is an environmental factor that we're experiencing presently. And that is what the pandemic has done and what it's caused presently, that sense of isolation, that sense of withdrawal. So it's important to understand when we look at depression, there's a complex interaction between our biology, between our psychology, and also between our environment. And so often people ask me, well, how do I know if I need medication? How do I know if I'm a candidate for antidepressant medication? As I said, it becomes important to do a comprehensive assessment to determine if you're experiencing the biological symptoms of depression. And let's assume that that turns out true, that you're positive, that we see that there is a brain dysregulation. Then what? Most likely, medication is indicated. Typically what happens in the mental health field, if medication is indicated, you get referred to see a psychiatrist. And the psychiatrist will go look at you, look at your symptoms and say, Rick, try this antidepressant medication. Let's see how you do on it. See you in 6 weeks. When I come back, how are you doing? Well, I don't feel any. He'll increase the dosage. It's what I call the educated trial and error method. For those of you out there, it's important that you know that there is a state of the art now that we can do gene testing. We can find out your genetic makeup and what medication you would best respond to. We take a look at your genes, your genetic makeup. It looks at how you process medication, and it puts medication in 3 baskets. Do not prescribe, you might prescribe, and use as directed. Our experience clinically is that 95% of the time, we get it right the first time with no side effects. So there is gene testing. What else can you do with feelings of depression? Certainly, talk therapy. It's what I do I was telling Bill before we went on the air, I spent 8 hours today doing therapy and helping people work through that psychological piece of the depression. So psychologically, we can help you work through that sense of hopelessness, that sense of worthlessness, to put meaning back in your life, to work through the traumas or the loss, through having someone to talk to. The other piece of this that's so important is start to move. The research shows medication, therapy, and walking is a most effective treatment. Most effective treatment for depression. We see the best treatment response when we are involving all three. Stu's back.
I'm back. How about that?
Hey.
Yes, thank you for speaking about what you just did. I just want to go through a few more questions.
Please.
We do have several that are coming in. One person writes, in the current climate of these uncertain times, we have the coronavirus pandemic, we have extreme unemployment, we have the weather issues that are going on, we have the political situation going on. You know, how do they deal with this? How do they deal with all this emotional turmoil happening right now? And what can a person, I mean, I know it might be similar to what you answered before, but I think that there might be a little bit more involved here. And for me, my answer is stay away from the news.
I like it, Stu. Avoid any negative impact,
Right.
influence.
Anything else you want to say about that?
Yeah, let me just think on those things for a minute. Certainly, we are in very difficult times. You know, it's funny, I was reminded as you were talking, I was involved in a research study down at the University of Miami. And we were looking at the impact of cancer on patients. And our hypothesis was that it would negatively impact, the diagnosis would negatively impact the emotional well-being of patients. A fair assumption. But we found a subgroup of people that post-diagnosis did better emotionally. And we started to look at what made them different. And we saw that there was two different coping styles. One coping style was emotional reactive. Oh my God, what's happening to me? I can't believe what's happening to me. You know, the next was a problem-solving coping style. I have this problem. What can I do about it? What can I do about it? So we have the coronavirus. We have the demonstrations. We have the potential storms out there. We have our chronic medical illness. What can we do? Solve the problem. Take care of self. That becomes so important.
Okay. You ready for the next one?
Please.
We have lots and lots of questions.
I love questions.
We have lots of questions, so sometimes I need you to cut back a little bit shorter or speak a little faster.
Just go like this.
Great. What does DNA testing, who does DNA testing for depression?
So the company that we're using, and there's a couple out there, is called GeneSight. And GeneSight is gotten some very good research recently written up in the New York Times about really being effective. We do it in our office. We take a swab. not a nasal swab. We take a cheek swab on both sides of your cheek, we send it away, and 3 or 4 days we can determine which medication will you most likely best respond to. So the name of the company is GeneSight.
Great, thank you. Many MS patients have a double whammy: the depression and the unusual situation we're living with, and the depression caused by our condition. Is it two different types of depression, or is it all combined into one?
Again, so let me use an analogy. I get someone referred to my office, and they're referred to me, and they're on an antidepressant medication. And when I do a history, I find out, wow, their spouse just passed away. And they went to their primary care doctor and immediately was placed on antidepressant medication. Well, being depressed after your spouse dies is an appropriate response. So we have to do a pretty good assessment to see if the depression is reactive because I'm depressed, because I have MS, and I'm mourning the loss of some of my pre-illness functioning, or is it truly a clinical depression? That's why a professional should do an assessment. Certainly, I suspect that because of MS and lesions, that there is a more biological component for some people.
So yeah, so feeding off of that question, there was another question that person wants to know if having MS creates more of being depressed in the general public.
Yes, absolutely. The incidence of depression, okay, is much higher in MS than the general public. And even when we control for similar chronic illnesses, such like a Parkinson's disease or seizure disorder, the incidence is much higher in MS patients, where we even control for chronic diseases.
Okay, great. Well, not great, but it's good. Thank you for that answer. Okay, so going back a step, person want to know about the gene testing. How do they get it done, and what kind of costs are involved?
So it involves a real simple, we take 2 swabs of your cheek, left cheek and right cheek. The cost, we're finding that most insurance companies will cover it. I just learned today, I sent someone to the office to have it done. If you have Medicare, it's covered at 100%. Other insurances, we don't know. If someone's interested, they can certainly give the office a call and we can find out for you. It does require a professional referral. You can't contact GeneSight and say, I want to get my DNA tested. It has to be done through a physician referral.
Okay, thank you. A woman wrote, I'm a woman and I live alone and do not have family. I'm isolated. Can you address recommendations or discuss for people something that we can do under similar circumstances?
Boy, I feel for you, and especially since we're in lockdown, and I'm concerned about with all of our opening up. I'm still staying at home and working until I see. I don't know if you're computer savvy, but certainly there are virtual support groups that you can find. I'm not aware of any right now specifically for MS patients. You can certainly reach out to friends okay? You can do virtual friendships, virtual happy hours, and it's a software that, to be honest with you, I was not sophisticated enough or knew anything about until 2 months ago. So there are things that you can do to stay connected with friends, family. You need to make sure and take care of yourself. Get out, go for a walk. I'm not telling you to go out and be social with people. Get out, get some fresh air if you can. Let yourself be out of the house. Take this as an opportunity to do some of the things that you haven't found time to do, and do them now. But definitely reach out to friends, family, if you can.
Okay. Long question here. Thank you for that last one. How about situational depression when you've had MS for 30 years and was never depressed until his mobility has seriously declined and the spirit, wow, don't know what happened here. Okay. So, I like doing everything in my life and my future possibilities have been upended. Anything to say about that? You know,
Yeah.
everything, it seems that everything is coming crashing down on this person right now.
No,
And after 30 years of having MS. So.
and it sounds like there's just been more recently a loss of real mobility, if I heard the question right.
So yes, and that the walking is becoming dangerous, and he or she is tired of pretending that he or she is happy. Humorous is not an option. Not interested in anything. Not interested in doing anything, and that it's not a matter of acceptance, not accepting who they've become. It just sounds like that this person has a lot to talk about. So I don't know how you're going to answer all that in 20 seconds.
Making a point. No, I'm kidding. No, but seriously, this is a perfect example, and I appreciate that question because I'm sure you're not alone in this, you know, and I know so often when you're dealing with a chronic illness, it gets to a point where it really gets to you. So one of the things that we have to be careful of is not to look at what I had, not to look at what will be, but to look at what I do have. And in dealing with any chronic illnesses, we certainly tend to look at what I don't have or what I lost. Look at what you have. Now, certainly, that person who just shared that question, some red flags went up for me. Loss of interest, not motivated. Things are not as pleasurable as they used to be. Those are definitely biological symptoms of depression. Get an evaluation. Talk to someone. Medication may be appropriate that could be really helpful for you.
All right. Hope everybody can, thank you for that answer. I hope everybody understands we're running a little bit late and we're going to have Dr. Harris speak a little bit more about where he was before. But before we get to that point, I have one more question to ask. And this has, this person writes, both my husband and I are not working and have 2 children who are out of school. Worried about the bills, cost of medication, cost of her medication, and not knowing when this will all end. There are more arguments than usual in their household. They're all extremely stressed out. How can we, as a family, better manage this? I thought that was an important question to bring up right now. So.
No, it really is. You know, it's funny. I have found and again, first of all, realize you're not alone. So many of the families that we work with in our practice are going through with what you're going through. And I've seen an interesting phenomena occur. in some ways, I was talking to an adolescent last week, and he came to me. His parents couldn't get him out of his room. He never was engaged in the family. He was always on his flat screens. And I'm going to use a fictitious name. And I said to him, Bob, how you doing? He says, oh, I'm doing okay, man. I've been out, me and my family, we put puzzles together. We're watching some movies together. Could not get this kid out of his room. We can take a look at this and see this as an opportunity. Yes, we can look at what we don't have, but you still have your family. And it's time to pull that family together, start to talk about it, be honest and open with the kids, let them know if there are children, let them know what's going on, and look at what you can do and not what you can't do. And I think that will start to build some communication. Kids are resilient. They understand when you say, well, we can't afford that anymore. They get it. So communication becomes so important in that case.
Okay, great. Thank you for that. And how would you like to take another 5 minutes and talk about what you were speaking about earlier when I cut you off? All right, and then we're going to come back and take a few more questions.
What was I talking about? I forgot.
I don't know. I have MS. I forgot.
Great. Two brains, right? Are better than one,
Yes.
maybe not.
I thought maybe you had notes, but if not, we could just continue with questions also, because I think a lot of people are going to get something out of the questions that are being asked. So
My preference.
another person wants to write, going back to the gene therapy. Do you know how much it costs for that gene, for the gene testing?
It varies based on insurance carrier. So, for example, Medicare covers it at 100%. Other insurance carriers, I don't know, because there's so many different insurance carriers out there. Now, I do know that the company, the worst cost is, my understanding is $300. They'll even waive that if there's a hardship.
Okay, thank you. All right. Just so everybody knows, that somebody wrote in that there's an organization called PAN Foundation that can help with MS drugs and food grants. So they just want to let you all know this. And it's P as in Peter, A as in Apple, N as in Nancy Foundation, that if anybody needs, help with those two things, that, you can contact them. All right, next. I'm interested in knowing how to better communicate. Sorry about that, everybody. That's a repeat question that just came up of another question that was already asked, okay? All right, next one. This has definitely affected my treatment, as I see a physical therapist and an acupuncturist that helps me with pain and stress reduction. Are there any apps or directions you can give your patients that will help them with stress reduction that they can do from home via different application apps that are available?
No, absolutely. I'm not aware, I can't recommend a specific app, but certainly if you just go to the App Store, there's one called Calm that can help you with just relaxation. Mindfulness, that's the new buzzword for learning relaxation training. So pain management is real important, is to learn how to relax, because the more pain that we experience, the more tense the muscles become. And when the muscles become tense, it lowers our pain threshold. So learning how to be mindful. There's apps for meditation. I use a really silly app called Yoga. It's for nothing, and it's just 10 minutes of morning yoga that helps stretch. It can help with mobility. So just go ahead and go to the App Store and read the reviews. There's a ton of stuff out there that can be helpful.
Great, thank you.
And,
Going
and the
back
other
to,
thing is,
go
go ahead,
ahead. You first.
stay moving, keep
Great.
moving.
Great.
That walk, that fresh air, listen, there's some research done that a walk in the forest in itself and being outside has so much therapeutic value. I encourage all my patients to start walking, or just be outside, even if there's limit. Go ahead.
But for those that cannot walk, those that are using mobility equipment, the same thing applies. Get outside,
Absolutely.
get the fresh air, right?
Absolutely. Yes.
Okay. Next one is going back to the gene testing again. They want to know what you said about the company that does gene testing and who has to prescribe it. Is it a psychiatrist or a psychologist or the general doctor or what?
GeneSight is the company. In our office, it's done by our psychiatric nurse practitioner. I believe it has to be a psychiatrist or a psychiatric nurse practitioner. You have to have been credentialed by the company for them to accept the order.
Okay, great. Thank you for that. So whoever asked that question, I hope that you heard the answer now. Okay.
And
next.
Stu, if you
Sure.
can make sure that my contact information is available, I have no problem with people calling the office if they have questions or want more information. I'll make sure they get it.
Okay, great. Thank you. So another question is, person wants to know, they're in all this quarantine with their family 24 hours a day. This is a question that's similar to what was asked before, but a little bit different. And the person feels that he or she is getting a little bit sick from all the stress. And I know you said earlier, and you just may want to say it again about the way to get past this. All right. You were talking about yoga. You're talking about biofeedback. I mean, we really didn't speak about biofeedback. You and I were talking about it earlier, but you may want to say something about it now as well.
So let's talk about, more importantly, get sick. When they say getting sick, it's important for us to understand that. But what are some self-management techniques? Certainly, you can get some professional help, as Stu's saying, biofeedback. I keep reiterating walking or exercise, mindfulness, meditation, relaxation. So the sickness is coming from the stress response. Being under chronic stress, our body produces chemicals when we're under stress, cortisol, etc. And when those chemicals are at high levels, we start to get nauseous. We may have acid reflux. We may have irritable bowel. So it's important we learn stress management techniques, exercise, mindfulness, relaxation. That little app I told you that I use can be helpful. Be mindful of your coping strategies. Remember, problem solving compared to emotional reactivity. What can I do? Okay. Reach out. Talk to the family. Improve communications. All of that is so important. And you know the other thing that is so important? You see this throughout the research, is spirituality. I'm not talking about a belief in God, but having meaning in your life. It's important to have that sense of self, that sense of what meaning we have in life. That's what spirituality, that is what helps us get through so much of what we're going through.
All right, thank you for that. How does a person get rid of their negative self talking. They're talking negative all the time rather than being more positive with themselves.
Done. No, I'm kidding. Boy, I'll tell you what, if I could, that's the core. That is the core of so much of what causes us depression, anxiety, is that negative self-dialogue. So one of the things that becomes important is journaling. Journaling has been demonstrated to be really therapeutic. So sit down, and when you have a negative thought, pull out your little pad or your phone, write that negative thought down, and then practice changing it. Recognize that negative thought and then confront it. It's not easy. That negative thinking comes from somewhere. Was it an interjected critical parent? Did I hear it all my life growing up? Am I perfectionist that my expectations are unrealistic and I'll never achieve them? So I put myself down. So often I believe that's what I need to do to drive myself. And Stu, what I find so fascinating is the people that are so negative and critical of themselves would never say the same thing to a friend. And so I kind of say, do unto yourself as you would do unto others. That's the new golden rule.
Great.
So recognize a negative thought, get some insight into where it's coming from. Is it keeping me motivated? Is it keeping me from succeeding? And then confronting it. It's back to that Rick method.
Okay, thank you. So next thing was, sounds like it's this person knows me really well, but they want to know how you keep a person like her, who it sounds like it's like me, home rather than wanting to get out and do things. Okay, cannot take no for an answer. I mean, heck, the last time we had a hurricane here in Florida, I had to open up my back door and go out into the backyard for a minute just because I wanted to see how strong the wind was blowing. All right. So how do you keep a person like that? How do you keep a person locked down that is stressing about getting out and getting out?
So when the pandemic first started, my adult daughter called my wife and said to my wife, "Hey, Mom, you need to get some handcuffs because Dad's not going to that concert that he has tickets for." And so when I came home, my daughter called me and said, "I don't know if you know this, you're not gone tonight. Mom's got handcuffs." So back in the day, we used to use straitjackets. Today, you could get handcuffs from Amazon.
Right.
There's a reality here. I can't control someone else. All I can do is point out, I'm concerned about you. I'm worried. I'm concerned if you go out there, you may bring that damn thing home. So I'd appreciate if you didn't do that. And it's difficult because I'm like you, Stu, I'm always on the go. You know?
That's right.
And so it's been difficult. So what have I done? So I go for my walks, okay? I'm outside, I go for my walks. I wear my mask. It's difficult, it's hard to control someone, but you can just point out the consequences of their actions and about your concern.
Great, thank you for that. You know, we're over our time here right now. We've answered a lot of questions. There are a lot of questions that are here that are very repetitive to just worded differently as to what has been asked and answered in other things. I don't see any new questions coming in from offline, but anything further than what I've already got, written and printed out. So is there anything else that you want to add to this conversation before we conclude?
Again, given the current situation, yes, there's a little book you can purchase off of Amazon, and it's called The Precious Present. It's a little fable. And if it's one gift I can give you all in parting tonight, and I appreciate so much this opportunity, Stu, to be able to share, I would hope, what I think is my wisdom. If there's the one gift, and that is to be here now, to try and stay in the moment, to realize that that's all I have control over. And that book called The Precious Present is a wonderful little fable to read for yourself, to read to the family, to give as gifts. It's really a fable on how living in the present becomes so important.
Okay, well, thank you for that. So we want to thank you again for joining us this evening, everybody that's out there, and Dr. Harris, and sharing this valuable information. If you registered for this webinar, please know that you're registered for our entire series of the MS Views Now. So you will get updates about upcoming programs. If you know of anybody that was not on here that you think, they may want to learn from programs that we're doing in the future, then ask them to get registered. Please know that on July 8th, we're going to have a discussion with Dr. Ben Thrower, obviously about coronavirus and COVID-19 and multiple sclerosis. We'll have other questions to be asked. We'll see what the pirate has to tell us. I say pirate because not that he's a thief, but Dr. Thrower likes to dress as a pirate during Halloween. So again, I just want to let you all know that you're going to be receiving an evaluation for tonight's program. We'd like you all to fill this out, please, and get this on back to us. And again, I want to thank you all for being here. So let's give everybody a round of applause and say thank you. And good night, everybody.
Night,
Thank you,
everybody.
Dr. Harris.
Thank you, Stu. Thank you, MS Views.